Greetings, and thank you for spending a few minutes with us to learn about what's happening throughout our region and our community as it pertains to the COVID-19 pandemic. Today, I'm pleased to be joined by Dr. Clarence Parks. Dr. Parks is the director for our Hospitalist program. He's also soon to be our medical staff president. And Dr. Parks is recently renewed his board certification in internal medicine, so congratulations, Dr. Parks, as well as being trained in pediatrics. And Dr. Parks has really been on the leading edge of the physician team in directing the management of COVID-19 care from a medical expert's perspective. And so he's made some time out of his very busy schedule to be able to share with all of you today. And so once again, I'm grateful for having him here. Thank you. Thank you.
So I think that there are several factors that are playing a role at this time. First and foremost, children are back in school. That may lead to the passage or transmission issue that we're seeing. In addition to that, there's this normalization that's been taking place in the community where everyone's liberalizing their travel. So that may be another significant contributor. In addition to some of the other factors that we normally see seasonally, there's cold weather, holiday travel, things of that sort. One of the most important things that we've noticed is that everyone's had this level of fatigue with COVID-19 and the pandemic, and we're letting our guards down a little bit. We're not using all of the mitigation factors such as wearing masks, creating an environment where we're socially distant at a healthy distance. All of those things are having factors at this point, and it's one of those things that we're seeing more frequent now. So what we are noticing here at FHN is that an overwhelming majority of our patients that we're seeing that require hospitalization are unvaccinated. As of 2 days ago, overwhelmingly 90% of the patients that are requiring hospitalization here at FHN are not vaccinated. The patients that we're seeing requiring critical care in the intensive care unit are also primarily patients that are not vaccinated. And in fact, the recent data from 2 days ago show that about 75% of the patients that are requiring that level of care, critical care, are not vaccinated. The average length of stay for our patients that we're treating have shifted. Those lengths of stay has gone from a minimal of 7 days, and we're seeing patients that are here for a month or two. Those are patients that are requiring continued care and continued observation. Those patients are not healthy enough to leave the acute care system. From the beginning of the pandemic, we have seen a definitive shift in the demographic of our patients age-wise. Initially, our patients' ages were 60, 65, 70, 7 decades of life and above. Now we're seeing a shift to more younger patients. We've had patients here that are 30s, 20s, and we've had patients that are in their 50s. So we've learned a lot in our treatment of COVID-19 patients and the illness in and of itself. So we've learned to make certain adjustments. Essentially, the core treatment has remained the same. Within the first 7 to 14 days, we treat patients with symptomatic care, and then we also use antiviral agents in the hospitalized patient. In the days of 14 to 21 and beyond, we begin to use treatments that are, in addition to antivirals and symptomatic care, we're using treatments like anti-inflammatory care because those patients are experiencing an immunologic surge in their system. So there are several symptoms that are similar for flu and COVID-19. The primary symptom tends to be generalized malaise, fever, and overall sense of not feeling well. In addition to that, we see fever, and then lastly, patients will have some degree of respiratory symptoms, either some chest congestion, cough, mild to moderate, or even severe. So that underscores the point that we must remain diligent, and we must also find ways in which we can get at the right diagnosis. Initially, we thought that if an individual had COVID or flu, then they could not be at risk of getting the other viral infection. However, we've learned in the past year or so that patients can have coexistent illness, which adds to their severity. So it is also important for us to be tested and know our status for both. What I would say is similar to what I've said since the beginning of this illness, is that it is very important for us to remain diligent. It's very important for us to do our part. We must remember that we are not only caring for ourselves, but we're caring for a community. So things and decisions that we make have an impact on our community, and that means let's remain resolved that we are going to continue all of the mitigation factors, wearing our mask, making sure that we're at a healthy, socially distant level, and making sure that if in fact we have any symptoms, we know where to get tested and to seek treatment. We do know that the earlier you get in to be treated, the better it is for you.
There's been a certain increase in activity that we've been able to see. So we've been in what we call peak capacity, bordering on surge capacity for the past several weeks, as we've seen an uptick throughout the area. That's created a lot of stress on our staff, whom are working incredibly hard. And so I'd encourage any and everybody, if you know a healthcare worker or see a healthcare worker, just express your thanks to them as they're dealing with a lot of increased activity. Throughout the Midwest, the state of Illinois is actually doing fairly well comparatively. However, we are seeing a sustained increase in growth in our positive cases, increased hospitalization, including utilization of intensive care unit beds. Where COVID-19 tends to pop up in different hot spots through different regions throughout the state, where we live is currently one of the hottest hot spots at this time, as well as southern Illinois. And that may have something to do with being close or on the state line. We certainly have hit our capacity limits in the past few weeks, but thankfully have been able to accommodate the number of patients that have come through our doors. Unfortunately, some of them have had to stay overnight or even longer in our emergency department before we were able to get them to our inpatient or into beds in the hospital. We've expanded our capacity, but one of our biggest challenges is having enough staff versus the actual space or number of beds. When a person needs care, we need to have enough caregivers to be able to provide that, not just placing them in a location. Hospitals throughout the area, throughout our region and the surrounding counties, we check in with each other on a daily basis, updating how many beds are available, what is the ICU capacity, how busy is the emergency room, how are you doing on staffing, so that we can help coordinate transfers if needed. So within our region, the census has been much higher for all hospitals in our area, so it's required a lot of collaboration and coordination, and we continue to work together to find a place if a patient has a need for a hospital stay and how we can help one another. Again, even for those organizations, one of the biggest challenges that we're all facing is workforce and really not having enough people to take care of this big peak or census that we're experiencing. Thankfully, we've had people willing to work extra. We've had people come in out of retirement to pick up some additional help, and so that's keeping things going for us. However, it's a daily effort to make sure we have enough people to provide the care that our community needs and deserves. With our intensive care unit here at FHN, we have 8 beds that are prepared to be intensive care unit beds, and that requires additional technology for patient monitoring, also making sure that we have the appropriate equipment for intravenous therapy as well as for respirators or ventilators, and that focused care for the individual. When somebody is that ill, it requires that intensive staffing. We can bring in additional or temporary equipment to expand just for a short time our intensive care unit beds from a technology standpoint and from an equipment standpoint and move it outside of our unit. It's possible for us to do should we need to do it. One of the bigger challenges, once again, goes back to having intensive care unit nurses, having enough respiratory therapists to be able to care for that additional or expanded capacity. So that becomes a bigger challenge, but should we need to, we can potentially do that and expand for a temporary period of time so that we can provide care to people that need it. We remain very active in making sure that people are able to get much needed surgeries completed before the end of the year, as well as ongoing procedures. One of the things that we learned early on in the pandemic when we had to restrict or limit the amount of procedures or office visits and services that we were able to provide is it really only created more problems later on. So for example, when we have our physician offices that are closed and people can't see their doctors, they end up in our emergency department, which creates even more stress on a very busy emergency department team. What we've also learned is that when people delay procedures, generally they're not going to get better. It doesn't just go away. There's a reason why they need that treatment. And oftentimes it becomes much worse and become much more difficult to manage. And in some cases, if a person is in pain and needs a procedure done, it just prolongs their suffering. So we found that that's not a good tactic to take. And I really encourage people to get your preventive wellness care done, to get those procedures done so that you don't prolong this and it becomes a bigger problem down the road. We remain ready and willing to take care of your needs, and it'd be a privilege for us to help you in any way. As we've begun to wind down from a very successful and safe FHN Festival of Trees event, I want to thank people for participating in that, and I hope that you had an enjoyable time doing so. I would encourage, as families get together, that you do so safely. It may take a little bit of additional due diligence on your part, just making sure people are feeling well before they get together as groups. I have heard some individuals that even for their family gatherings are asking people to do a rapid test or a Buy Next Now test that's available commercially at many retail outlets, including pharmacies. If a person is questioning on whether they're safe before they go and see somebody who is at risk or older, is they can perform that for just a little bit more peace of mind that it is safe to get together and gather. So err on the side of caution, but at the same time, I think it's more important than ever to enjoy each other's company, to celebrate, and to be grateful for all of the good things that we do have. And the importance of that human connection can't be understated. So enjoy that time, but enjoy so safely. And remember that as FHN providers, we're all here for you and wishing you a very happy, healthy, and safe holidays.